Hi friends, good evening and welcome to my channel Mookambika Nursing. Friends, here in this video we can see some questions from endocrine system. We will see the first question. A nurse is monitoring a client newly diagnosed with diabetes mellitus for the signs of complications. Which of the following, if exhibited in the client, would indicate hyperglycemia and warrant physician notification? Options are polyuria, diaphoresis, option C hypertension, option D increased pulse rate. Here a patient is already diagnosed with diabetes mellitus and the nurse is taking care of that patient, and among these options one of the signs may cause complication to the patient, and as a nurse she should notice that signs and she should inform it to the physician. Why? To prevent complication occurs to the patient. So that is the question. Our options are polyuria, diaphoresis, hypertension and increased pulse rate. So what is diabetes mellitus? Diabetes mellitus is an metabolic disorder characterized by increased blood sugar level in the body. Our normal blood sugar level is, for fasting it is 70 to 110 milligram per deciliter, and if it is postprandial it is 80 to 120. Okay, so if the blood sugar level is above normal, it is hyperglycemia or diabetes mellitus. The classical symptoms of this hyperglycemia include polydipsia, polyuria and polyphagia. This is the classical symptoms of hyperglycemia. Here patient is diagnosed with diabetes mellitus and he is existing polyuria. Option A, polyuria is persist for the patient. So as a nurse she should check the patient. Polyuria means it is an increased frequency of urination. So it should be noted to the physician that the patient is having polyuria. So the classical symptoms of diabetes mellitus include polyuria, polyphagia and polydipsia. Polyuria means increased urination. Polydipsia means excessive thirst, and polyphagia means increased appetite, increased hunger. Next question, second question. A nurse is preparing a plan of care for a client with diabetes mellitus who has hyperglycemia. The priority nursing diagnosis would be, options are option A deficit knowledge, option B deficit fluidolium, option C compromised family copying, option D imbalanced nutrition less than body requirement. So a nurse is preparing a plan of care of patient with diabetes mellitus, that is hyperglycemia means increased blood sugar level. So diabetes mellitus is a metabolic disorder characterized by high blood glucose level in the body. So the priority nursing diagnosis what she can formulate in case of diabetes mellitus patient. So we saw the options. Here, an increased blood glucose level will cause kidney to excrete the glucose in the urine. Okay, glycosuria, and this glucose is accompanied by fluid and electrolyte. Along with this glucose, fluid and electrolyte will be lost from the body, causing anosmotic diuresis, leading to dehydration for the patient. So the first priority nursing diagnosis will be deficit fluid oleum. The remaining option, deficit knowledge, compromised family copying also will come, but the priority nursing diagnosis is deficit fluidolium, that is fluid loss occurs through urine. Polyuria is the classical symptoms of hyperglycemia, diabetes mellitus. So first nursing diagnosis will deficit fluidolium, and option D imbalanced nutrition less than body requirement will not come. Why? That is polyphagia is the one of the classical symptoms. So the patient have excessive hunger, it leads to increased appetite for the patient. So imbalanced nutrition will not come over here, but deficit knowledge and compromised family copying can come, but the priority is deficit fluid oleum. Okay, option B is correct over here. Next question, the third question. A nurse is caring for a client after hypophysectomy. The nurse notices clear nasal discharge from the client nostrils. The initial nursing action would be. This is the question. Options are: option A, lower the head end of the bed; option B, test the drainage for glucose; option C, obtained a culture of the drainage; option D, continue to observe the drainage. This is the question. So here a nurse is caring for a client with hypophysectomy. Hypophysectomy means it's a surgical removal of the pituitary gland. So after hypophysectomy, the nurse is noticing that in clear nasal discharge is coming from the patient nostril. So the what is the immediate or what is the initial first nursing action is which she should do immediately? That is our question. So here after hypophysectomy, the client should be monitored for rhinorrhea. Rhinorrhea means nasal discharge, which could indicate a cerebrospinal leak. If rhinorrhea person means that indicate a cerebrospinal leak. So if it occur means immediately she should inform the physician first, and also she should keep in mind we should collect the nasal discharge and test for the presence of cerebrospinal fluid. Here our option: lower the head end of the bed and test the drainage for glucose, obtain the culture of the drainage, continue to observe the drainage. So option B will come correct over here. Test the drainage for cerebrospinal fluid or test the drainage for glucose. That is the correct answer. And first option, lower the head end of the bed, we should not lower the head end of the bed because it will cause again increased intracranial pressure. So we should not increase the head end of the, we should not lower the head end of the bed. And other option, option 3, obtain culture of the drainage. Here no need to do culture because the question itself it is there, clear nasal discharge is coming from the nostril. So it is also wrong. And continue to observe the drainage. If we are continually observing, again CSF leakage will come. So it is also not correct over here. And our option B, test the drainage for glucose, is correct. Next question, fourth question. After several diagnostic tests, a client is diagnosed with diabetes insipidus. A nurse performs an assessment on the client, knowing that which symptom is most indicative of this disorder. And our options are: option A, fatigue; option B, diarrhea; option C, polydipsia; option D, weight gain. So here a patient is diagnosed with diabetes insipidus and the nurse is performing assessment, nurse is performing assessment to the patient, and she is thinking that which among the following symptom is most apt for the diabetes insipidus patient. That is our question. So our options include fatigue, diarrhea, polydipsia and weight gain. So here diabetes insipidus is characterized by hyposecretion of antidiuretic hormone, that is ADH. So ADH, hyposecretion of antidiuretic hormone, causes diabetes insipidus, and the kidney tubules fail to reabsorb water in case of diabetes insipidus. And the classical symptoms of this diabetes insipidus include polydipsia and polyuria. So the classical symptoms include polydipsia and polyuria. Here our option polydipsia is there. So option C, polydipsia, is correct over here, and polyuria is also one of the classical symptoms. And also patient may have the urine is pale and specific gravity is also low in case of diabetes insipidus patient, and patient may exhibit anorexia and weight loss. These all the signs of the patient, but the classical symptom is polydipsia and polyuria. And the remaining option, weight gain will not come, weight loss will come, and diarrhea will not come in case of diabetes insipidus, and fatigue also one of the symptoms can occur in case, but the most symptom is appropriate symptom is polydipsia. Option C is correct in this question. Next question, and the fifth question. A nurse is monitoring a client receiving desmopressin acetate for adverse effect to the medication. Which of the following indicate the presence of adverse effect? So our options are option A insomnia, option B drowsiness, option C weight loss, option D increase urination. In this question, a patient is receiving desmopressin. So, what is the action of this desmopressin is? It is mainly given in a patient with or children with bedwetting. Bedwetting patient, we are giving desmopressin acetate, and its action is to help to reduce frequent urination in the patient. So, here a patient is receiving desmopressin may have water intoxication, that is overhydration, or hyponatremia is an adverse reaction to the desmopressin. So the adverse reaction of this desmopressin is water intoxication or hyponatremia, and early signs of this include drowsiness, listlessness and headache, followed by rapid weight gain, confusion, seizure and coma also occur as a result of overhydration. So in our option, drowsiness is there. So due to intoxication, drowsiness will occur in the patient. So option B drowsiness is correct over here, and insomnia, weight loss and increased urination will not come in here. Weight gain and listlessness, confusion, she's a coma and also occur in overhydration. So our option B drowsiness is correct in this question.